Sweet potatoes occupy a peculiar position in the nutrition conversation, frequently praised, occasionally demonized by low-carbohydrate advocates, and regularly confused with yams in American grocery stores, where virtually everything labeled a yam is actually a sweet potato. Cutting through the confusion to examine what the evidence actually says about daily sweet potato consumption reveals a food that earns its positive reputation through an unusually broad nutritional profile. A medium sweet potato with skin provides roughly 100 calories, 4 grams of fiber, 2 grams of protein, and most strikingly, over 400% of the daily value for vitamin A in the form of beta-carotene. That last number deserves to sit for a moment. Very few foods deliver beta-carotene in that concentration, and vitamin A is essential for immune cell production and differentiation, for the integrity of epithelial barriers in the respiratory tract and gut, and for vision, particularly the regeneration of visual pigments in the retina that enable low-light vision. Populations with consistent sweet potato consumption genuinely do show better vitamin A status, particularly relevant in contexts where dietary variety is limited. Beyond beta-carotene, sweet potatoes offer meaningful vitamin C, potassium, manganese, and B6. The orange flesh color indicates a carotenoid richness that extends beyond beta-carotene to include beta-cryptoxanthin and other compounds with antioxidant and anti-inflammatory activity. Purple flesh varieties contain anthocyanins, the same class of compounds found in blueberries, giving them a distinct antioxidant profile that complements rather than duplicates the orange variety. The glycemic index question requires nuanced handling. Sweet potatoes have a lower glycemic index than white potatoes when compared preparation to preparation, but cooking method significantly affects this. Boiled sweet potatoes have a lower glycemic response than baked sweet potatoes because the heat of baking converts more resistant starch to digestible starch. Cooling cooked sweet potatoes before eating increases resistant starch content, which acts more like fiber, feeding beneficial gut bacteria rather than rapidly raising blood sugar. For people managing diabetes or insulin resistance, these distinctions matter in practice. An interesting and underappreciated quality of sweet potatoes is that their beta-carotene absorption is significantly enhanced by consuming them with fat. Because beta-carotene is fat-soluble, eating sweet potato with a tablespoon of olive oil, a small amount of butter, or avocado converts considerably more of the provitamin to usable vitamin A than eating it plain. This is not a trivial difference. Studies have shown fat co-consumption can multiply beta-carotene bioavailability by a factor of 3 to 5. The cautions here are minimal but real. Oxalate content in sweet potatoes is moderate, relevant for kidney stone formers who should discuss overall oxalate intake with a dietitian rather than eliminating sweet potatoes categorically. For insulin-dependent diabetics, portion size awareness remains important despite the lower glycemic index. Beyond that, sweet potatoes represent one of the more nutritionally dense, widely available, and affordable foods in the produce section, a combination that makes daily inclusion genuinely defensible.